they already get funding to serve that child. If parents choose to keep them home or they want to make some other alternate, that is a choice they can make, and they can pay for that, or they would have to pay for that. Or if somebody's offering it for free, they can do that. But I want to make sure everybody knows from a funding perspective, we can't pay for it. Whether or not programs want to serve school-age children, if you have the capacity to do that and you're wanting to do that, that's up to you. We've had a few reach out to licensing. That's if the parents are paying and you all have the space and you're willing to set up and do some of that remote learning work. That is entirely up to you. There's nothing that would not allow that if you're currently licensed to serve school-age children and you're within your capacity. If you have space and you're wanting to rearrange, for many of you that have reached out to me or that I've talked to personally that have talked about your enrollment being down, this is certainly an area that you may want to consider. Maybe you might think about offering a classroom for school age, or maybe it's just preparing for if the school closes. So I just want to make sure that we're clear about the school age thing. If in your community, I am always going to support you all that are licensed. I've had some folks reaching out to me asking about creating an emergency opening for a facility because of school age care and concerns about it. I am not in favor of that. Just let me repeat that. I am not in favor. I am trying to route people to the search to look for what is available in the community already where you all exist that are licensed. I'm trying to explain that we already have many licensed programs that stand ready to serve children. They already have the capacity potentially to do that. Let's work together to make sure we take care of the people that have been doing this, some of you for many years, rather than creating a new facility. So I want to make sure folks know that. I've had lots of questions about can we create something very quickly? We think there's going to be a concern. I'm not opposed to working with new, especially in communities where there is a gap. Maybe there are some places and we have that, we can map it and we can look, but we will go to the search engine and we will look. And if we see, well, there's only one facility, yes, there might be a need in that community. I can't stop people from requesting a license, and I can't, we can't just not approve applications, but I have some folks that are asking to do things outside of licensing, quite frankly, and I'm just not comfortable with that. We are going to hold people to the state law. There isn't any emergency clearance to do anything differently. So we want children to be safe. We think it's important for people to have background checks and to really support the field and you all who are out there already doing all this work. So I just wanted you all to know that. We will work with communities if there are problems and if there's a gap or a need. But in general, my comment to folks is, let's look and see what's available in your community and why do you think there's maybe a gap or a problem. Let's discover if there really is. And maybe everybody that's in the community is serving pre-K children and there isn't a school age component, but we'll work with you and support you all to continue to do what you do best. Becky, I'm going to stop right there for just a second. Is Dr. Tumilson on?
I don't see him on the call yet. We're giving him a call to see if he needs just a reminder or if he's having some of that Zoom difficulty that many have experienced this week.
Okay, and maybe resend him that. Listen, they're really busy at the health department. I'm sure you guys can understand that. And he had agreed to be on today, but he may have gotten tied up with some other COVID things. So if he's not, that'll be fine. I want to just, simple reminders. I've had a few programs and we've had some questions about, or somebody will call and say, we were told that they don't have to wear a mask. So just as a reminder, all facility staff, should be wearing a mask in the building. Whenever staff are outside on the playground, that is an okay time to take the mask off. There's airflow and that can be done. But if you're in the building, all individuals in the building should be wearing a mask. So I just want to make sure. It's been very small numbers, but we have had a few folks that there seems to be some confusion. So I just want to make sure. I noticed a question in the chat box. If schools are closed on Fridays, will vouchers pay for that one day? So no, we haven't covered that, Sherry. If the school is officially closed due to COVID, and you have a child that's being served through vouchers, we will need to verify that through their calendar. And if the child's on vouchers, we would pay for that day. If we're talking about its remote learning option, if the school is offering all in-class learning, we won't pay for that. But if the school is actually closed officially, we will certainly look at that. And if you have children on vouchers for school-age children, that is a time when we can pay if it is an official closure. So we'll take a look at that and work with you. Any of you have schools that are actually closed, that children cannot be in the building, please send us documentation. We'll go to their website as well and just verify and work with you on any voucher children. We'll have to make sure that we get them keyed. They may not get keyed immediately, just so that you know. They might not get keyed this week because of the volume of essential workers and other processing that's going on. But if there are some, we'll try to look at that. Cassidy, I do see Pulaski County, and I think I had talked to someone, maybe it was you, about they are going to be dismissing every Wednesday at 11:30. So we would pay for a voucher from, you know, that's really a part-time or half-time voucher, but yes, we will cover that for voucher children. So I know all of you probably have different scenarios, so just be aware we'll work with you on those individual scenarios by district, but it is really if the school building is closed, not if they're just offering remote learning. Let's see. Okay, Robin, you've got a question here. All staff are to be in mask when inside the center, no matter what age of they work with. That is correct. I'm only seeing is there a requirement, and oh, there it is. Thank you. No, we do not have any mandates in place other than, I think, Ashlyn, it's for 10 and older.
10 and older.
Transport. Okay, I see nodding from my licensing staff. Kelly and Ashlyn are on, but yes, 10 and older. And if you're transporting school-age children and you're going back to full capacity for that transport, we would recommend that you put a mask on all children. Because if they're coming from only school age, you know, including kindergarten, if they're going to be riding on a vehicle that is at full license capacity, we would, you know, want you to have a mask. These children are probably learning to do that in school and are probably going to be more comfortable. But if you are transporting younger children, you need to be at half capacity or lower capacity, and we can't require masks for children under the age of 2. I'm not really a big proponent of recommending for under the age of 5, but I do know we might have some 4-year-old and 3-year-old preschool age children that are riding the vehicle and maybe used to wearing masks through school. So if that's something they're comfortable with, then you can have them do that. So I'm going to stop. I see someone on the phone that is a special guest, and I want to be respectful of his time. So Dr. Tumilson, thank you so much for being with us. Guys, here's an opportunity. I know Dr. Tumilson is going to talk about some of the things that we're seeing at the health department with regard to children in COVID in licensed childcare settings. But it's a great time if you have specific questions about COVID. We're going to give him at least, you know, 15 to 20 minutes to share anything and answer questions. But again, I'm trying to be respectful of, and I know there's a lot going on. So Dr. Tumilson, if you want to share updates.
All right, can y'all hear me? Yeah, all right. So I first want to say, I think in general, I think child care centers are doing a great job instituting the safety measures. I mean, that's been my observation whenever it is rare that I, you know, end up having to call one of the directors or somebody that I notice a whole bunch of deficiencies. I mean, usually it's one minor thing or and 1 or 2 helpful suggestions that maybe are a little outside of the things that, but in general, I think a really good job has been done implementing, you know, pick up and drop off. Everybody's doing that. I hadn't talked to anybody that's not doing that. I'm finding increased compliance with adults masking. I hear y'all are talking about that, and I'd echo that. You know, maybe a 3-year-old, it's hard to keep a mask on consistently, but a 5- and 6-year-old, we can train them to do it, and that's what we're encouraging schools to do too. But I think that's improving, especially amongst the staff. I've not heard anybody say, oh, we don't really make our staff use it all the time. I mean, I haven't heard that in several months now. And so I think the cohorting is going really well. I think people are learning not to mix their groups as much. And so I'd say keep up with those other good things. One other minor thing that I notice is the floater. And I know that in many of your normal operations, you use somebody that floats from room to room to help out where they're needed to give the teacher a break. But that has been a problem in some cases when the floater turns up being positive. And so then you really end up with the potential, depending on what they're doing in those rooms they float to, of exposing a bunch more people. So if there's a way to get to not do the floater or to do it in a different way where you're minimizing how many rooms they're floating to or what they're doing while they're in the room, I'd encourage that. The big thing I wanted to talk about today, and this I don't think is due to childcare facilities not desiring to do it or not even saying to their staff that we need to do this, but it's the tendency of human nature to minimize our symptoms. So there have been a number of cases lately where the director didn't know because the worker didn't tell them, and they went through the screen and said, no, I don't have any symptoms. But turns out they had some minor symptoms and they ignored them and went to work anyway. And so we've gotten people who've come to work sick, right? They're not very sick, so they don't think they're sick, but they've got symptoms. So it might be more the message, okay, don't come to work sick. And what I mean is you don't show up with any of these symptoms. If you got any of these symptoms, you call me first. Even if you think they're minor, even if you think they're your allergies, let's talk about it first so we can be careful. And in those places that have had that happen, you know, they've unfortunately learned that lesson. That's just human nature, right? I mean, we've all done that in the past, right? Yeah, we come to work a little sick because maybe it's just going to go away. And sometimes it does, and sometimes we don't even realize it, but we've infected a bunch of people with colds or whatever. But this year, as you know, that doesn't work. That's going to cause lots of problems. So I would say, what would I recommend? I would revisit it frequently with your staff and also tell them, look, the reason for this is, and you can quote those examples of centers have had cases where somebody had minor symptoms. They didn't think much of them, so they didn't tell anybody they had symptoms. And then lo and behold, after being at work 3 days with symptoms, they got worse and went and got tested and they were positive. And they exposed a whole bunch of kids. They exposed other staff workers who they love and work with. And so we need to be extra careful about that. That would be the one appeal that I make that seems to be the biggest chink in the armor right now, which, I mean, we're not going to solve human nature, but what we can make the point. And I think once people realize the reason you're emphasizing that and give that example, then I think they might understand it better and be thinking more to not minimize their symptoms. And other than that, I don't really have anything else to bring up. And I guess I can take some questions, Ms. Tanya.
Sure. So I'm going to run through, there have been a couple of things in. I'm going to start with the mask requirement. So I know there are situations where it's only, if it's a family child care center, possibly there's only one staff. Let me just say this, gang. You're wearing the mask to protect yourself and the children that you serve, regardless of how many other adults. So you could be asymptomatic, the children could be asymptomatic. I would encourage, if you're an adult, wear the mask when you're working with children, always. I mean, just in the building. You know, again, when you go outside, if you want to pull that mask down and you've got a big playground area to play on, there's a lot of airflow, that's different. But in that building where you're in confined spaces, please wear the mask, regardless of whether or not you have other adults. It's really a protection for you and the children. Remember, you're serving them, and they could come in and infect you. So the mask offers some protection for both of you for that.
Hey, Tanya?
Yes.
Can we talk to Dr. Tumilson and get his ideas on the neck gaiters? Because we're seeing a lot of neck gaiters. And so we have been talking about they are not as good as masks, but maybe we can get Dr. Tumilson to weigh in on it.
So yeah, there's been a bit of controversy of late about that. So a small study was done which looked at basically trying to visualize different droplets coming and how well they go through masks, right? Because that's what Tanya's saying. We're trying to block this stuff to protect the people around, not only ourselves, but the stuff that we breathe out when we speak and when we breathe, et cetera. And so they did studies on various types of masks. The bottom line is, you know, a medical surgical mask works great. A double layer sewn mask works well as well. It needs to be multi-layer. That's the bottom line in all this. A lot of these net gaiters, so there was doubt cast onto these net gaiters because they're that stretchy material, right? So you can kind of imagine it stretches, maybe it's a little more porous, small stuff gets scattered through it more easily. What it looked like they used was probably single layer. There have been other small studies since then that tried to use more industry standards of technique for the way they analyze droplet stuff that thought it looked like, and also another small study that if it was double layer, it's probably okay. You know, one other thing that I've seen a lot is the masks with the valves. Those, even the CDC says, CDC is really cautious, right, on all the recommendations. Even the CDC says masks with valves, not a good idea. The reason is those are exhaust valves so that you don't feel smothered, right? Well, the whole point of the mask in this situation, not the whole point, the biggest part of the mask in the whole situation is to keep stuff from going out. And if you got a mask that is letting stuff out, then that defeats the purpose. So masks with valves, bad. Gaiters, I would say if they're single layer, they need to be double layer. So if you can, you know, have parents get ones that are double layer, how can you tell? Well, you just got to pull it apart and look at it. I still think it's better they wear something than nothing. But yes, you want to maybe send a communication home. Hey, we know gaiters are really popular. Please make sure it's double layer gaiter, because the two layers, they're not going to match up, right? So the first one's going to block some of them. The second one's going to block more. None of them are going to block all of it, right? But I think the bottom line is we want to encourage wearing masks. And if a double layer gaiter, I would say we're going to be actually adding something to the mask mandate that tries to specify that. You know, another thing that study showed that just to kind of your regular loose bandana, not a mask sewed out of bandana material, right? That's two layers and sewed to fit around the face, but just a bandana that you kind of tie behind your ears, and it hangs down like you're you know, like you're playing a cowboy. That isn't as good. Why? Well, it flops loose in the front, right? So that stuff is not as much of it's getting blocked because it's not even close to sealed around your face. So I discourage those regular bandanas, but not, you don't have to, if it's made out of bandana material and it's multi-layer and around a mask around the face, that's fine. The bottom line is it needs to be more than one layer. So your surgical masks that you buy, those are all more than one layer. That's why they work well. Plus they kind of seal around your face. But any mask that is multi-layer, except for the ones you buy with the valves, anything with a valve bad, anything with multi-layer good. How about that?
Sounds good. Dr. Tumilson, there are a couple of questions that have come in. Cassidy, if a parent was tested due to a physician's request, not because they were exposed to a positive case, should the entire family quarantine or children remain out of the center until test results return? Different answers to this question, I think, are coming in. So, Dr. Tumilson? Yeah,
I mean, this is a pain because it's not easy to have a hard and fast. Now, if the doctor requested they get tested, then that's kind of a different situation than someone that just was curious and decided to go get tested. But if a doctor requested it, I think it's probably best that, you know, usually doctors aren't just going to be recommending people get tested just for the heck of it. And, you know, they must have had a symptom, or there was some concern the doctor had about a symptom or something. That now, if the parent goes gets tested, like here's the caveat. So in general, I'd say the safe thing to do would be, yes, to have the child wait at home with the parent who's hopefully waiting at home while they're waiting on the test. But say a parent like goes and they're going to have surgery, right? And their facility is, we're not requiring it anymore, but their facility is requiring testing before surgery. Well, that's not somebody who's had an exposure, nor do they have symptoms that are concerning. If they were going to have surgery or it's some situation like that, they just had to get it as a prerequisite for some reason, that's a different situation. You don't have to keep that kid out of daycare, I wouldn't think, because I mean, the safest thing would just be to keep everybody out who has a test pending, but especially the contact to that person, that's a whole nother situation. So that would be the caveat I'd say to that. Did that answer it?
I think so, Cassidy. Hopefully that will help. But if you have a specific and you want to give us a call and let us take a stab at something, if you get an individual situation, all of you reach out to your licensing staff. We are working with the Department of Health at the call center. And so there is a number. We can put it in the chat box. Becky, if you or Ashlyn or Kelly can put that in the chat box. That way folks will know if there's a specific question related to these kinds of issues and you need help with that. I'm going to go, Dr. Tumilson, sort of follow up to some earlier things. Is there a specific time frame to monitor minimal symptoms before suggesting testing, or should we suggest testing right away?
I just suggest it right away, or at the very least, I mean, the easier way to do that, I think, is suggest testing. If they balk, say, then go see your medical provider. Because, I mean, if they're sick, they need to see the doctor anyway, right? And the doctor then can be the one that say, no, I don't think this. Let the doctor be the one that says, no, I think this is influenza, and I've tested them from that and they turned out positive. Great, then you know what it is. They get better, they meet the doctor's recommendation for when they can go back after flu, which is going to be a little different, right, than COVID. But I would say that I'd say recommend testing, but don't recommend they not go see their doctor. If they're kind of, I don't know, you can always say, we recommend you get tested. Fine to do that through your doctor's office. The public health clinics, the local health units are available for testing as well. If your doctor feels like it's going to take too long through him, you can make sure you let him know that it's possible. If they just want to go get tested and because the symptoms are mild and they're going to follow your advice and they don't think they can get to their doctor quick enough, they can also be tested at the local health unit. They just need to call ahead.
Great. So we're going to start this next one. I want to do some prefacing, but then I'm going to let Dr. Tumilson join with me on answering this. So the last well, it's probably been about a month now, but we had a couple of scenarios where therapists went into a facility. They were going in to deliver services. Those are mandated, required services for children. We want to make sure that children get their therapies, whatever those therapies may be. We have things in our licensing regs. But if you all haven't looked at that, the section about the whole IDEA and the requirements, there is one little caveat there, as long as health and safety can be met. So I just want to point out that we are in a very unprecedented time around health and safety, and we are starting to see some things that have been reported. So I want us to talk through this a little bit. We still want services for children to be met. That is the expectation. However, and there are a couple of questions. Programs, early childhood license programs, have the right and responsibility to work with a partnering agency who provides services to do it in the safest way possible. It's all our responsibility to do it in the safest way possible. One of the first questions is, what about a therapist coming into our center who has been to 10 schools? So here's what I would say to that. The therapist should be getting screened into every scenario that she's going into. There should be screening occurring. So while, yes, there could be a situation where they're asymptomatic, if they're wearing the mask and they are being screened, that helps mitigate some of those factors. And that's what should be happening. But the second question you all have in there is, are therapists allowed to see children from 2 rooms at the same time? That is against what we are currently doing. And so I think that's where we're going to have to work together. I want us to use common sense and practicality whenever possible, but I'm not sure that's the safest way. It really goes against the requirements about mixing children. So I do know I've worked with some programs who are working through these challenges, and they are doing some remote therapy, some remote speech specifically. Some therapies can't be done that way. But I would say in general, we do need to be pulling out 5 children from 5 classrooms and putting them together, because that is in itself kind of takes away all that you all are trying to do within your facility to keep this group together and this group together. So Dr. Tumilson, that's the best guidance we've been giving programs today. Any other things that you would want to share there?
Yeah, I would agree with that. I mean, I think, you want to keep your cohort intact if at all possible, and that would do that. I don't know, some, I've been getting questions from schools about therapists, and some therapists are really taking a lot of measures as far as the PPE they're wearing, which protects them, but it also helps protect you secondarily if they got exposed to. So basically, for a healthcare worker, if they're wearing an N95 and some type of eye protection, whether goggles or face shield, and gloves and a gown, if they wear it through the whole time they had an encounter with a positive person, that's not considered an exposure. They're not a close contact. That's a low risk exposure because they had all that protective equipment on. So if they're doing that, then there were questions from schools. Well, should their contact be limited to 15 minutes? And the therapists were saying, we can't do our therapy in 15 minutes. No, if they're wearing all the protective equipment, there's no reason they can't have a longer visit with a child. So that's one thing that I've heard about. But in general, yes, this sounds like, therapists that aren't doing quite all of that. I definitely agree. They need to be screened. They all need to have wet masks on. That's going to protect the kids that they're in. And it'd be much better if they were the ones that went, if they've got to go room to room, then they went, or if there's a separate space, but see kids from the same room at the same time that are already exposed to each other instead of, like you said, 5 kids from 5 different rooms.
Thank you, Dr. Tumilson. This probably goes along with this, and I know we've talked about this before, but face guards, especially clear. I know we've addressed this before, that there for therapy, for speech therapy specifically, that is okay. Dr. Tumilson, any updates on that?
No, I'd say, that's still okay if you need it for the purpose you're doing, which speech therapy certainly fits, right? If you're doing some teaching or therapy that requires the lips or the mouth to be seen for the effect that you need, it's fine. Take the mask off, wear the face guard during the period of time that you need the lips or mouth seen, and then as soon as that task is over, you put the mask back on.
Okay. So I'm gonna keep scrolling down. Just FYI, for those of you who are asking questions outside of health specific, I'm gonna go back down. I'll answer those questions in a little bit, but I want to give Dr. Tumilson time to take all of the health questions and get those resolved first, or get those dealt with first. So I think we talked about the net gaiters. There was just a concern about choking hazards on playgrounds with net gaiters. All of those things, for all the reasons that we've talked about, I think we've established that those are not really the best protection for children. And then I know, Debbie Mays, thank you for that sort of social emotional concern about, people being afraid to nurture, hug, express empathy for children during this time. So she's just asking, can you address ways a provider can still give appropriate, safe comfort? I'm just going to let you guys know, I have testified to this at the Capitol. I'm going to keep saying it. It is much more difficult for us to physically distance from children birth to 5. That is just, you cannot put a 6-month-old or a 3-month-old over in the corner and say, we're going to keep 6 feet. We all know this. It's not practical. We have to pick up babies, hold them. It's really not that much different with 3- and 4-year-olds. They still need to know that the caregiver, and so I'm not saying go into your classroom, hold your arms out. What I am saying is if Mary is over in the corner crying, you should go over and express to Mary some empathy and try to find out what's going on. And if that means touching her, then that means touching her. If you're wearing your mask and you all are cleaning and sanitizing and keeping your hands washed, there's a lot of safety in that. But Dr. Tumilson, any other things that you could share about providing comfort to children during this time?
Well, I would just say from a practical standpoint, in general, when we've had, a case in one of your small child care cohorts, as some of you already experienced, we pretty much just assume that everybody there's had close contact with each other. The kids have had close contact with each other, and the teacher that's in that room too, right? We're just kind of assuming it because we know from feedback from DHS and from our own experience that that age of kids, it's difficult to keep them apart from each other and even from the teacher. You have to interact on that intimate level. That's why we've emphasized the cohort so much, right? Because we're assuming that within the cohort, you can't keep that distance that you need to. So I'd say, yeah, if you need to, go ahead and do that.
So there's some questions about drop off and pick up outside the facility. So Dr. Tumilson talked a little bit about this. If that is something that can be done practically, yes, we certainly encourage that. That's not mandated. What's mandated is that there be a screening process before children come in. The drop off and pick up does not have to be outside. If you're doing it at the front of your building, it just keeps everyone on the outside where there's airflow, and you're not risking, possible exposure on the inside of the building. But I just want to clarify that that's not a requirement for it to be outside. If it's workable and can be done outside, if you've got an awning or a place where parents can drive up, and because we're going to get into weather at some point, so that might not be practical for some of you. If you're going to do it at the front of your building, preferably, and if the time frame, which should be a short period of drop off, then that also risks, if it's less than 15 minutes, for example, that also helps with the risk mitigation. Have your parents wearing masks. You may have to let your parents know that that's a requirement to come into the facility, that you're going to need to wear a mask. Make sure that your staff are all wearing masks. Dr. Tumilson, anything else? It says if all of our drop-offs and pickup are in the building, but only 3 to 5 minutes, is that acceptable? And I would say yes, as long as everyone's wearing the mask.
Yeah, I would say what you're trying to do there is keep the parent who's positive and doesn't know it yet from exposing other people in the daycare besides their child, right? So if you can do that inside, fine. If it's maybe you keep the kids in one area, and then as parents come in and order, okay, Johnny, there's your mom, run over to mommy, and he runs over to mommy or whoever it is that's picking him up, then, and they don't have contact, the parent doesn't come in and shake hands or hug the teacher or mix amongst the other children. That's what we're trying to avoid. So, doing it outside is probably the easiest way and the best way to do it. But that's what you're trying to accomplish, is to keep separation from that parent and other kids or teachers that aren't their kid that they already have contact with.
So I'm going to let licensing staff, there's a question about do youth, and I'm guessing when you say youth, we're talking about older age, school age children possibly, have to maintain 6 feet during all activities, including board games. I don't think that's a mandate for us. That you may want to check with your funding sources. You may have different requirements, but just from our standpoint, Kelly or Ashlyn, anything specific to that you all would want to add?
No, that's correct, Tanya. And it kind of sounds like we're talking about older children, maybe school age. Just remember, again, the 10 and up, they're going to wear their mask as well. But we don't have any requirement that the children maintain a 6 foot distance from each other.
Okay. So I'm going to go back up. Manica had a question about if someone that her husband works with was tested and the results should be back today. If that individual who is exposed her husband tests positive, how does she need to handle that?
Well, right now she doesn't need to worry about herself because she's only even if they are positive, she's only a secondary contact through her husband. It becomes kind of a cascading event, as y'all have all experienced probably by now. But even if that person tests positive, the person who has to quarantine is her husband, ostensibly, if he's been in close contact with that coworker. And so if she can separate from her husband once that's known, so right now I don't think you have to do anything. Just keep your ears up so you know what happens. But if that person does turn positive, then it's her husband who needs to quarantine. If she can stay separate from the husband, then she should be okay to continue work, because the husband at that point is just a close contact, right? Now, if the husband subsequently goes to get tested, because every close contact needs to get tested and is positive, well then if you've been around your husband, you've got to quarantine at that point. But if you can even if you've got a household member who is a close contact and has to quarantine, if the rest of the members of the household can separate from them, like stay in a different room, not go in the same bathroom, clean in between, stay out of the same areas if they're going to be in there at not be in the same areas at the same time, clean copiously, then it's allowed that the other household member doesn't have to quarantine at the same time. Some families throw up their hands and go, we can't do that, this is ridiculous, and they just quarantine together. That's an option too, but that wouldn't even have to be considered until the coworker tests positive.
Okay, thank you, Dr. Tumilson. The phone number to the Arkansas Department of Health has been posted in the chat box for any of you who may need that. Just make sure that you have that. You know, for those of you who haven't had an experience, and I know several of you have by now, but for those of you who haven't, it's having that information at hand, because your sense here is to panic whenever you potentially have a positive case. So get that number, post it on your computer, post it by your phone, so that you can start to report it and find out what you need to do. It'll help keep you calm whenever you get into that situation. And I'm sure some of your colleagues that have already had the experience are willing to share what that's like, but just want to make sure you guys have the phone number to report into the Department of Health, or if you have questions. The next question, if there is wide exposure in a preschool or after school program, can the person exposed ask for a fast test for quick results versus some results that are taking up to 5 days, and what is the protocol? Dr. Tumilson, I'm not really up to date on what's going on with the testing time frame, so I'll let you take that.
Yeah, so the issue here is that there's 3 types of tests. Antibody test, that's a blood test. Don't do it, not valid, not going to help you know if you're actively infected. So there's really 2 types of tests we're talking about. One are rapid or point of care tests. Those are ones they're very similar to like the flu test your doctor has in his office, or the strep test, right? They take the swab, they say, we'll be back in 15 minutes, and they go run it. That's a rapid or point of care test. That kind of test should only be done, it's being done for other people, but it really is recommended to only be done for people with symptoms. So the exposed person, simply the exposed person who's a close contact, shouldn't have that done. They should have the standard PCR test. Yes, that's the one that has the longer turnaround time. So you can go, turnaround times are starting to vary quite a bit. Some doctors still, it's 7 to 10 days. I'm hearing others I'm seeing, they're getting it back in a day or 2. Others, it's more in the middle, 3 to 5. The public health lab here in Little Rock runs all of those standard PCRs for the tests that come from our local health units. So you can call the local health unit in your area, and they'll give you time to come by and get the test. It's generally coming back in about 48 hours, sometimes earlier.
Thanks, Dr. Tumilson. So I've got a couple of questions related to therapists again. So let me just walk back through that a little bit. There's a question about whether guidance as to whether therapy should be inside or outside the classroom, and then should therapists wear gowns. Let me just kind of walk through. It is imperative that services for children who are on an IEP be delivered. We support that. Our child care licensing regs support that. Where I think we're starting to get concerned is when we have, an outside therapist go into a facility who then tests positive. If everybody's doing what they need to do, these things are going to happen, but it is sort of making sure that we all have put in the best safety plans. So programs at the licensed child care site and any therapy agency, whether it's the co-op or private therapy, should be working together to determine what is the safest way to deliver services during COVID. It should not look like it did last year. It probably will not in any case look like it did last year. So I think, Dr. Tumilson, I would offer these things. If at the front of your building you have a space where services can be delivered and people are not having to walk back into your building, that's one option to consider. Is there some space very at the front? That's an option. A separate option is for therapies like speech that can be delivered remotely and online through Zoom or something, which could be delivered to a group of children in the same classroom, not separate children from classroom. But if you've got a couple of children in a classroom that are getting speech, that could be delivered, or it could be delivered to children in all those classrooms if the teacher can get on. So remote for speech really can work really well for everyone. I think the third option that Dr. Tumilson has said is if the therapist is coming in with full PPE equipment, meaning gown, gloves, everything, like they really have covered that and the programs are all comfortable with that, then that is another way to do risk mitigation for spread. So any of those options, there probably are some that we haven't thought of. I think the programs and the therapists, providers need to sit down together and figure out the best, safest plan for delivery of these services. And if you need help from us during this time, please reach out to our licensing staff, to myself. You know, I put my email in the chat box, but we're willing to help. Again, it is not an option that services get delivered. We have to deliver, but how they get delivered is definitely going to look different than it has in the past. And Debbie, Sandra Withers, thank you for posting in. Head Start website has done a webinar on providing social and emotional support to children during COVID. They have some real practical solutions. Thank you for sharing that. For Debbie and all of you who want to look at that, that's something that's available and for you all in early childhood. So if somebody can get to that link, we can post it. We are school age and wear masks. Should students wear masks in the gym? I would say in that enclosed space, I would encourage that. These are school age children. They're probably used to wearing it. You are in a building. If you know, especially for 10 and over, if they're younger children, you know, but if you've got 10 and older in that space, you know, yes, we would expect that. There's a question here, Dr. Tumilson, and you may know, what are thoughts about replacing air filters in the program's heating and AC systems with a MERV 13 filter?
Sorry, I don't know enough about that to give you a good answer. I'd say call somebody that knows about HVAC. You know, the question, I mean, if you research it and that type of filter is going to screen out, you know, basically the small respiratory droplet particles that the virus rides on, more power to you. It'd probably be a good idea. You know, a normal air filter is not going to do that. So if this is a much better filter, it might be, but I can't give you an educated opinion on that. Sorry.
Thank you. Thank you for taking a stab at it. So yes, if you have questions about things like that, you know, we can certainly ask around, but please know this is a time, and I have seen some of this where people are trying to, you know, stay in their business, but make sure that you've really fully researched and feel comfortable before making big purchases. We're not requiring these things, and I don't want you all spending your, you know, limited resources without really feeling comfortable with decisions. I definitely think researching that. I know that Jackie Govan had put something out, and we can put that on our website. I think it might be on our website, Becky, related to filters. I think Head Start had done some research and work. It may be those specific filters. I don't remember, but we certainly will check in. But thank you, Carol, for that question. I'm going to, Dr. Tumilson, I don't see any more health questions. I know you're really busy. If you need to jump off, I'm going to go back and try to answer some of the payment and other questions. But we do so appreciate you all at the health department and you specifically for joining us and for answering questions.
You're welcome, and y'all keep up the good work. Y'all are doing a good job.
All right. Okay, gang, I'm going to jump back up. I saw some questions that were up here earlier, and I just want to make sure I don't miss something that had more to do with other things. So one, Colleen, thank you. There's a question about that they're thanking us for the funding for PPE. We can thank the federal government for that, and we are pushing that out. For those of you who are just opening this week for schools, pre-K programs, probably some Head Start, the staff are working on processing those payments right now. So if you have not received your payment because you were not open, do expect to see your payments in the next few days in the coming week, but they are working on that right now. We have not considered creating a warehouse. We do not have funding to create a warehouse, and I'm not in favor of creating a warehouse for state government. I appreciate, we certainly will help you. I know probably supplies are because of school starting back. I'm sure there's been a big, I haven't heard that. This is the first time I've heard that, but I'm not surprised to hear that there might be a little bit of a shortage. We can certainly work with our child care aware sites. They might be willing to locally provide some support for that. But I don't think we're probably the best conduit. We've done some things like that years ago for pre-K, ABC, where we purchased supplies. And I will tell you, that was not a good situation to be in. It just didn't go as smoothly. And I'm not sure that we've learned anything that would help me feel like we could do it any better today than we did then. But I think our child care aware sites are definitely a good resource to work with. Again, just supporting what already exists out there and what's locally available to you all. You know, we certainly can take a look at that. And I know some of them have been involved in that and have worked on getting equipment out. So Colleen, if there's anything specific, if you'll reach out to us, maybe we can do some connections and help you with that, even temporarily. I think things will settle once school gets underway, but I'm sure there is a little temporary, you know, hiccup in the supply chain as things start to gear back up. Question about, do we allow school-age children in the center who is supposed to be virtual on Monday and Thursday? So then I'm guessing you mean, could you allow that child to come on Tuesday, Wednesday, and Friday for childcare? As long as the parent's paying, or you have a payment source, we can't pay for that at the Division of Child Care, but if the parents have a payment source and you want to accept school-age children during this time when they aren't in school, that's entirely up to you if you're licensed for school-age children. The thing I would encourage you to do is, you know, just make sure your license for school-age care stays within the range. And if you feel like you need to make, I talked to a provider this morning who her enrollment was down in probably some of her younger age children, and she turned a classroom into a school age program or services for school age. So, you know, for those of you who are struggling with enrollment and things for younger children, you might want to consider doing some things around school age, but you certainly can serve them. I just think the funding, and I just cannot emphasize that enough, you know, if parents want to choose that and that's their only option for children, and you're a licensed child care provider for school age, absolutely, you can provide care. We just can't pay for full-time child care for school age children out of the Division of Child Care, but you certainly can serve them.
Hey, Tanya, can I also add that if you guys are planning to do that, if you will let your licensing specialist know that you have made that decision, that would be great, because we're trying to also just keep account and the understanding of how many of those types of situations that we've got.
I see Brandy on the call. Brandy, there's a question from Jennifer Easley about parents who have submitted essential worker apps. Let me just tell you what I know. We have about 500 to 600 applications that are in a pending, which means they really haven't provided everything required to process. Most of these are processing within a few days if everything comes in. In other words, completed application. I had one last week that didn't have the provider on it. So I look at them too, and it's hard to know what to do with something like that. So the application has to be complete with the provider listed. It's a one page, very simple. It has to have some documentation, either birth certificate or social, to verify proof of U.S. citizenship for the child only. And it also has to have proof of residence for the family. So something that has mail, you know, to their home address that's verified when you look at their application that that's where they live. And then something from the employer, because we're not worried about income, but something from the employer, either an email, a letter, a list of employees that work there that have applied, but something official from the employer that we can say, okay, here's our documentation that these staff or this staff person works at Hospital or at Jonesboro Public School. So I don't know, Brandy, if there's anything you would want to add to that.
If they're unable to provide documentation for their employer, a check stub, one single check stub will do. It usually has the listing for where that person is employed, and they usually have access to that fairly quickly. So if they want to add just one check stub so that will verify, that will be great. Thanks,
Brandy. So yes, we're not looking at the income, but a check stub will serve as a way to document where individuals work. And for those of you who don't know, you know, school personnel are considered essential now that school has started back. So all school personnel, all K-12 teachers, maintenance staff, cook staff, everybody in a K-12 setting would be eligible as well. Okay, Jennifer, sorry I missed this one when Dr. Tumilson was on, but are children coming from 3 different schools on an after-school vehicle allowed to mix within the program once they arrive at the center? Are 6 feet required for afternoon activities? And if one student is asymptomatic, would we have infected students from several schools if they mix? The answer to the last question is yes, potentially if you mix children. So I know this gets complicated for those of you in areas where you're serving multiple school districts. You know, and what I would say is we want you to be practical and use common sense to the degree that you can kind of keep children together by school is better. Even if they're in the same space, if you can put a smaller group of this group came from Nettleton and this group came from Jonesboro and this group came from Brooklyn, something like that, it is better. But I'm not sure how we completely get around that if you're picking up from multiple school districts other than trying to. Kelly, Ashlyn, anything you would add?
I would agree with that. I'm assuming what they're saying is that maybe the childcare facility is that after-school vehicle that's picking up. I'm thinking that's where they're going. And I would agree with that. I mean, yes, you could potentially impact those different school campuses. But I think if you are doing your absolute best to follow, just making sure that you're keeping the vehicles clean and then transporting is as safe as it can be, then when you get to the facility, if you can keep those guys together, because they would have already been by each other on the van or the transportation vehicle. So if you can kind of keep them together and make that your cohort that we heard Dr. Tumilson talk about, I think that would be the best. And that way you've got these them together when they're at your facility and you're providing the care. Kelly?
Right, and that would also help with contact tracing if you do have a positive case. If you keep, because if they're riding an after-school van together, they're probably all school-age, so they could be in the same group once they get to your facility. So that would be good. That would be a good way to do it, and you would have that documentation from your rosters and from your sign-in sheets in the classroom when you do have to do contact tracing.
Thanks, team. I appreciate you all taking that one. Muriel, you had a question about recording how funds have been spent. So let me there are funds that we are sending you all based on your license capacity and Better Beginnings level for purchasing cleaning supplies, PP equipment, you know, all the things that you might need to help you keep your facility open and masked. However, you normally do that for auditing purposes. All of you, you know, who have to get an audit, I'm sure I would say keep just documents. We're not asking for that. We are only asking whenever you have to close due to a positive case and have to access deep cleaning sanitation funds. So that is separate. When you have that happen, you all will submit those invoices to a specific email address for that, and we're working with the health department. So we know, I talked to a provider yesterday and her case came through this morning. Like I see those on the daily if there's a positive case. So we have a way to verify that, but that's only if you have a case and you're having to close to quarantine or close to clean, you know, a room overnight or something like that. For the money that we're sending you for maintenance and cleaning, sanitation, you know, just follow your normal. Hopefully you have a filing organized system for that, I hope, you know, for auditing purposes. But for the state, we're not specifically asking for any invoices for that. I would just encourage you to follow your normal bookkeeping process for anything that you're spending that comes from outside your organization. Yes, you have to be a participating voucher provider in order to access the Child Care Development Fund. So if you are currently a voucher provider, or if you're not and you're interested, you just need to work with our Better Beginnings team and our staff and family support to get set up. And we have worked with several providers to help work through that process. The primary thing I would tell you about this, just so everybody knows, you know, we have a small process here for that. You have to take, you know, an online assessment and a very brief PowerPoint class, whatever you want to call it, in order to be a voucher provider, and you have to fill out paperwork. The biggest hurdle is not here in the Division of Child Care necessarily. It's you have to be set up with the Department of Finance Administration in order to be paid. I know you may not understand this, but I do not have funding here. It is over in a banking state system, and we send invoices and they pay the bills. But it is not here in my division. So it is a process. So I just can only say it's a process. We will work with you to try to make it go as quickly as we can. But if you're not currently set up, it's going to take a moment. It's not quick because they work on the processing side at DFA, and we have to transmit things to them. So it takes just a little bit of time. I will point out that we have, except for those who are opening this week, we are down to about 100 plus providers that are not set up in our payment system at all, that we're working to try to get paid. And we're just going to keep steadily working that. There have been a few providers that said they did not want to take the funding, and we certainly respect that. But I just want you all to know that we're going to continue to reach out to these programs and try to pay them for staying open, being open, reopening with this funding that the feds have given us. So there were 400 to start with, and we're down to about 100. So we've made a lot of progress, but it is time. So I know my licensing staff are getting questions about that. I think the main thing is connecting the right people to help make that happen. But just repeat, and please tell your friends if you have others who are not on this call, the payment process is not through it is just something that we connect with. We cannot write the check from here. We have to send it over to the Department of Finance Administration to pay the bills, and that's how they get paid. So I do think they've done some written warrants, which they don't like to do. Instead of doing a direct deposit, our preference is direct deposit into a bank account, but I think they have probably done some check warrants during this time. But we'll keep working at that. So just wanted you to be aware. Let's see, let me go back up and make sure I haven't missed anything. Sandra, thanks. Sandra has posted the info, I think, about the social emotional supports through Head Start. Yes, Sherry, I think a university employee would be considered. Everyone in the I think we put education. So yes, that would be somebody. If they've started back to college and they're actually on site, as long as they're not doing remote work, if they're actually going on campus to do their work, we'd certainly encourage them to fill out an application. I think they're considered a state employee too. She is a 7-hour program. Is it okay to shorten the playground time to 30 minutes? So you're trying to probably do shorter time frames. I see Kelly and them. Go ahead, Kelly.
Yeah, to allow for smaller groups to be out on the playground at a time, that is certainly okay. We have talked to your licensing specialist because we have considered those on an individual basis, but that makes sense so that you're not all in larger groups out on the playground at the same time.
So there is a question about, the next one is about the numbers of children and staff, and I have that pulled up right in front of me, gang, because my staff are so wonderful to keep it updated. So from March through today, this is cumulative through the entire event, there have been 137 children and 184 staff. So that is as of right this moment. That doesn't mean there won't be some added. Unfortunately, there have been several this morning. So still very small. I think Dr. Tumilson alluded to that. So thank all of you for your incredible work to keep these numbers small. Will the funding be considered taxable income? Okay, now you're asking me an accountant question, and I really don't know the answer to that. I will try to find out from some of our finance folks. I think any funding that you get, if you already get CCDF funding, if that's considered taxable, then this would be. But if it isn't, then I would say no. But I'm not a tax accountant expert, so I don't know. If you have an accountant, you might want to reach out to them. I will also try to find that out and let you know that as well. I'm making a note of your email address so we can send an email. Okay, Donna has posted information about application and assistance with Arkansas Better Beginnings? Okay, gang, it is 11:03 and I see nothing else in the chat box. I just want to thank you all from the bottom of my heart for all the hard work you're doing. I know this one is a big week and a hard week since school started, and just, you know, for those of you who are not on the school side, we have lots of people on this call who have been going at it since March. So they certainly are there. If you want to reach out to one of them to ask them a question, they probably have a few things figured out. For those of you who are just opening, we're all in this together, and just, you know, keep those hands washed, keep sanitizing, wear the mask, and do your very best to keep safe out there. I see something. So there is a question. We are still being encouraged to not allow outsiders inside the facility for pictures. You know, you all as a facility, I'm not exactly sure how you would do that. I'm not saying you can't do pictures this year. We are not taking any stance on that. I would say whatever you do, you want to have a really safe way to do that. The photographer would need to be screened. The photographer would need to be wearing a mask. Children, you know, who are going in there, as long as the adults are wearing a mask and the photographer stays back, I think you could probably do pictures, but I would be very careful. I mean, you are allowing someone, if you can do it in the front of your building, that'd be better than letting them go into your building and potentially exposing folks. But, you know, appreciate that's a good question. Elizabeth, thank you. Set up a prop outside for this year's picture. Yeah, take advantage of the beautiful Arkansas outdoors and do those pictures outside. Thank you.
We've actually had people do that.
I think that's a great idea. Sorry, I'm usually telling people get outside as much as you can. So yeah, do those pictures outside. Thank all of you. Have a great rest of your week, and we will talk in 2 weeks, gang.